There's lots of different ways to approach it. I think the MDS Foundation, as we're talking through here, is a wonderful way to start accessing clinical trials. There's many patient advocacy groups that can help with this issue. Clinicaltrials.gov is a website where there's various search functions and queries can be made for MDS clinical trials. Even just having an open conversation with one's primary hematologist oncologist and say, could I be referred to a center that conducts clinical trials or an academic center or a larger community practice who has this option is really a reasonable way to approach it. Even a simple request for a second opinion may open opportunities to access for clinical trials. I think an important message should be, though, often there's benefit in having these discussions early on in the treatment course. It may be that one does quite well with standard of care or watchful waiting or other flavors of monitoring, and clinical trials aren't always needed at various points in an individual's MDS disease course. But I do think it's valuable to have asked the questions and even had the consultations prior to a time at which all prior lines of therapy or different approaches at treatment have been shown to be ineffective. Because sometimes if a patient has had a great deal of prior therapy and only meets someone for consideration of a clinical trial at a later point in their disease stage, there may be fewer options for enrollment on a clinical trial at that point in time. I don't think most physicians are threatened by questions about clinical trials, and usually they'll refer a patient to a website or another physician who can answer, more granular questions and things like that to help decide if a clinical trial is correct for an individual patient.